I'll call the meeting to order. So first item on the agenda, and let's go ahead, roll call. Dr. Kingsley will be joining us. He is currently out of town. He will try to join us soon. So let's go ahead and do roll call. Susan?
Present.
Kim?
Hey, Dr.
Present.
Michael? I'm here. Zach is not here yet. We will make sure to make a notation in the minutes verbally once he arrives. Let's go ahead and proceed with the Pledge of Allegiance.
I pledge
allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay. Oh, I gotta see the agenda. Can I borrow yours? Sorry, I left work, came straight here. And we have any guests? I do not see any. Seeing none, we will acknowledge some public attendees who are not here. May the minutes reflect Dr. Kingsley joined the meeting at 6:02. Let's review and approve the minutes. Has everybody had a chance to look at those?
Yes.
All right, I entertain a motion to approve.
I make a motion that we approve the minutes from May 21st, 2026. I'll second.
Motion and second. Any need for discussion? Hearing none, I'll go for a roll call vote. Susan?
Yes.
Kim?
Yes.
Michael, yes. Dr. Kingsley?
Yes.
Jason? I don't see anything in the old business. We'll go on to reports and subcommittees. Let's go ahead for the director's report.
So I'll let you all have seen my report as far as vital records and food handler cards. Still continue. I guess the only thing to mention is we have now completed a full 3 years here in this building because we moved in May. On our official first day was May 1st of 2023. So we have officially been here over 3 years. That's very hard to believe for most everyone sitting here, I think.
Unless you're an AC fixer guy. Throw this softball up, I'm gonna swing at it.
And we are still working on our HVAC stuff. And it's just, and I had talked to Dr. Kingsley, you know, with the up and down of the temperatures, it gets a little tricky of just when we can have them out, but we are still troubleshooting some of that. This room in particular is the main room right at the moment we're having a hard time with, but as you can see today, it's quite comfortable. The humidity in here is fine, but that's today. And so we will see. But we do know the heater that we added that will helps keep the humidity down. It is not working in here, but that will get fixed. We're just waiting for the right time to get them out here to do it as we find other issues. Anyway, moving on to the budget overview. At the end of May, we were 41.7% through the year. Our revenues were $3,088,943, or 73.8% of our total expected revenue. Our expenditures were $1,637,285, or 39.1%. So we were right on target. Our money market balance was $2,629. We were about $392,413 less than last year. But again, we all know we had $250,000 that we put in that CD. And then we are also putting money into those reserve accounts, which are not reflected in that balance. So roughly we're about even to where we were. Our lease purchase debt obligation, we are about $144,000 less than, well, almost $145,000 less than we were last year. We're at $2,038,177. Sometime during the course of this year, we will sink under the $2 million mark. You will see, I'm not going to dance, I'll make Taylor dance the little jig, but someone, or Dustin, someone will do
You know,
the
this
little
is
jig.
recorded.
I mean, Cheyenne's new to the team. So
I was
Yeah,
gonna say,
so
Cheyenne.
maybe it'll be
If either
Cheyenne.
of you ladies feel
Cheyenne.
uncomfortable about his comments, just let me know.
We'll just make Dustin do the dance.
Oh, there you go. Okay.
I'll start practicing now.
But I am getting excited as we watch that number keep going down and down. You know, we started with that number being 5 million. So as we see that number, and it has been less than 4 years. So we are making quite a bit of progress as we have made that number go down. Our customer service survey, and I think everyone knows we started this back in August of last year. As you look through here, a lot of good numbers for the year. Moving down, how easy was it to use our services? We did have another 3-star. There wasn't anything real indicative of what the issue was. Another 4-star, and then 22 people rated us with 5 stars. Again, outstanding results. How friendly and helpful was the staff? 2 at 4 stars, 22 at 5 stars. And then how would you rate the service? I guess I missed 2 at 4 stars and 22 at 5 stars. Some of the highlights this month, I always enjoy, you know, we have staff, and I'll be talking about them a little bit later in depth, but our staff is what make the health department, but it's always nice to hear them being commented on and complimented. Carla was amazing. She was very kind and helpful. Nice people. It was the best experience. Bailey and Kyle were the instructors.
Donuts.
Made the class so easy to sit through. Kyle should definitely bring donuts to all the classes, but he was excited to see Bailey. They're excited to see them out on their inspections. So, you know, usually you don't want to see the health inspectors. So, you know, saying you're excited to see them, that speaks a lot. So what can we do to improve, making it easier to access forms and things needed? Not sure. It had to do with birth and death certificates. It's also the one that gave us the 3. So I think maybe they just wanted some of the forms and stuff to be a little easier to do. I think you know, as we get more online centric, but some of the things currently with our current vital record systems, you have to come in and do it here, because we have to be able to get your IDs and be able to prove who you are, just to be able to protect your identity and that type of thing. Because if you can get someone else's birth certificate or even their death certificate, depending on what you're wanting to do with it, that's a real problem. So some of that is just, we can't provide it as easily as some people would want. And then the other things, it was donuts. Bring donuts, Kyle, or nuts, or cheese. So I think Kyle needs to feed the.
Do we need to amend the budget to address this feedback from our customers?
For Kyle to.
Sorry, I couldn't help myself, everybody. I love that comment, by the way. That was fun. Somebody who knew how to leave a good comment.
All right, so we've had a lot of handovers going on, so a lot happened this month. So Cheyenne took over for Rebecca. Rebecca has officially moved on. And so we were sad to see her go, but Cheyenne is already stepping up into her footsteps. I mean, she's been gone the last 2 weeks. I don't know where she went, but no, she just got married and went on her honeymoon. No, but she's here today. So.
And I've heard that Rebecca, I got a call yesterday from Rebecca. She has been offered a job contingent on a good background check and good reference check. So as soon as I get a check in the mail from Rebecca,
Yes.
so I can provide that good reference check, she will probably get a job.
Just gonna do it for free, but okay.
This opportunity.
So we started doing some health educator interviews for Cheyenne's previous position, and we're still in the middle of those. And then we had a new public health intern start. His name is Ethan. He couldn't be here today. He's out of town for a wedding. We'll see if he's able to come to the next board meeting. But he's a real go-getter. He's already doing a lot of things. He's starting to take initiative and things. So he's got some projects going on. So we're excited to have him. I think I mentioned last month the fire marshal or inspection had came back and there were several deficiencies. We are in the process of working on those. We have 9 out of 10 completed. The last one is scheduled for Monday to install a new horn and strobe, and then Tech Electronics will come back and they'll do the reinspection. The fire marshal already came back and we talked to him. He said, "You're pretty much good to go." He said, just when they come back and do that, just send him that report. So, yes.
Does the health department currently engage a company to make sure the fire extinguishers and all the fire safety equipment are up to speed for the fire marshal?
Yeah,
And
yeah.
who
So
is
that's
that?
the Tech Electronics.
Tech Electronics.
Yes, that's
Okay.
who we're using right now.
And
Are you guys satisfied with them?
we are looking at another option.
I bring it up only because I have faced similar issues with certain vendors and wanted to make sure that you and your team were aware there are a lot of other good opportunities out there for folks to keep us within fire safety compliance.
So for this, since they did the inspection and the fire marshal basically said they have to go in and cancel the deficiency. So for this one, we wanted to stick with them so that they're still doing the reinspection. And they ended up giving us a discount. However, they moved from Lenexa to Topeka and they charged mileage. So now they're charging us like $250 just to come here. And so we are, after we finish with this, we're gonna be looking into some other options. And
I'm happy to be available to give any feedback to the staff that are tasked with searching and getting any thoughts on companies if they're having any difficulty with deciding.
okay.
I'm not wanting to put my experience to tell you what to do. But if you run into any issues or need some assistance, I'm happy to volunteer feedback.
We may reach out to you, but I believe the fire marshal's report came through.
You guys are gonna be fine.
Yeah.
But that's a lot of money to spend for something like that people who own buildings less than a mile from here have wrestled with and can provide some feedback and documentation on similar services to buildings that are less than half a mile away.
Yes, based on a few issues we've had with them, we plan to look. Yeah, we've already started.
Sure call,
looking into
sure
some
call.
other
I'm here to
companies.
help you.
But yeah, we can, if you have some suggestions. But yeah, that should be taken care of after Monday, so. I think Andrew already mentioned, we're still having some HVAC issues, but today seems to be a lot better. So we'll see what happens as we go forward. For the community health assessment and community health improvement plan, we did end up choosing MOFI, the Missouri Public Health Institute. They're the ones who did our strategic plan. So Northland Health Alliance is going to be using them for our next Chaw and Chip. So that was officially approved. Health Ed has had several events this month. They had the Mother's Day 5K where they had 331 participants. Several staff members worked it and a few staff members even ran in it. So that was exciting. And then we submitted the maternal child health grant work plan for 2027. That has been approved. And we met with the maternal child health coordinator from the state, and she came here for a visit, and she said that she said normally she has lots of questions for people. We pretty much breezed through it. She said everything looks pretty good. I mean, she had a couple of minor comments, but it went really well. And so we're ready for the next grant cycle.
What's her name?
Macy, thank you.
That's not met that day, right?
Yeah. So here's our report for harvesters and our home visiting programs.
And now we have had 2 months, I think, of doing our harvesters at the earlier date and time. And the truck has arrived on time. And we've been able to set everything up the night before, and that seems to be a lot better. And we cleared the parking lot for our day-to-day business a lot earlier. And so that has been, I think, a lot better. Dr. Chape, sorry.
No worries. At the risk of lengthening the meeting, I did review everything, and if you scroll down just a little bit, a curious thought I had was we were doing home visits. I am not real familiar with the clientele that don't have somebody else who can make home visits, but we're making home visits. And tell me the structure behind the home visits, because usually if there's a payer source, are these individuals who don't have a payer source who need these services, or has that been vetted? Meaning in-home services usually are covered by third-party payers. I wasn't sure what our niche that we're fulfilling there. If you could flesh it out for me. I'm not saying it's wrong. It's just.
I'm not sure who wants that, but I think.
So all of our home-based visiting is a specific grant that we are funding our clients, and we can bring it back to you.
That answered my question.
But
we have a grant to do the home-based visits.
Yes.
I was trying to make sure we weren't duplicating services that are funded through other taxed entities.
No, they have to meet income requirements. It's what Tia Biggest does.
Thank you.
And we actually had talked about it before, and I just don't recall the exact, but it is not typical public health, and that's why I don't remember it.
That's okay.
And it's
so
a
this is a grant
specific
program that we are providing services to our citizens, but it is not a de novo program we instituted that may have other payer sources. So that was my concern.
Right, it's not something that we are spending.
I'm good.
Any tax levy money on it is. Tia does several programs like the car seats and different things, cribs and stuff that we have. They're kind of niche grants or contracts that she does, like all these like niche things, but they are specifically funded and paid for her to do those. And if that makes sense.
Yes, it does. And if the citizens of Blaine County needed this without a funding source, of course, we would enthusiastically engage that. But I was curious as I read through this, I thought home-based visiting. I wanted to make sure we were being cost effective with taxpayer dollars. You guys have addressed it. Thank you. Proceed, please.
And then with environmental, we've had several things this month. So 2 of the big things where we did inspections for the Argosy. So they have 8 different facilities. So I went with Rachel and Bailey and was able to see them do a couple different kinds of inspections because we have based on risk. So there's low, medium, and high risk. And so in the Argosy, they have multiple different types of risk levels. So that was really interesting to see. And then the other big thing was the Morton Amphitheater. We did their pre-opening.
One second, just so I can explain that a little more. So when she says they have different risk levels, they have multiple permits in that one facility. So like they might have a concession stand or
coffee shop
that has a permit. So if something happened, they have a sewage leak or something, that portion might get shut down. The other 7 would still be able to continue to operate. Or something happens to 2 of them, And so all those are separate. It's one business, but they're separate permits. And so that allows them to be regulated separately and inspected separately. In essence, they operate as separate businesses. They have different staff, they have different management, but they're all under the umbrella of the RESA.
So Andrew, quick question. So are those all those 8 permits? They're actually 8 separate permits that they're paying for,
Yeah.
and they're cool with that? Did they request that, or did we offer that to them, or how did they come up with 8? Just curious.
That's just.
So it's going to be a combination of things, but typically when they do their initial plan review, that is going to be determined by us too. You know, part of it's like different, they're going to have different kitchens and different locations. So that's how it's going to be determined. Sometimes it might be one permit in like a satellite location, but usually it is going to be multiple permits.
Okay. I just don't want to feel like we're gouging them out of money either. So as long as they're happy with it, I'm happy.
It is I mean, it is clearly different food establishments.
What, and if you could just do a quick, what makes it a high?
So we have a whole sheet. And so the number of meals that are served is one of the questions.
Okay.
How many steps in the preparation is another. The clientele. So let me give an example. Fast food usually comes in right in the middle. It's kind of like a medium priority because it's not really, the food comes in like, I won't say a specific place, but their name starts with an M and they have the big yellow M. I don't know what that could be, but their food comes in frozen off the truck. It comes off the truck, goes into a big freezer, goes on the grill, frozen. It goes on to a timer, and then it goes out the door. Everyone's wearing gloves. Like, it is food safety wise. There's not very many steps in preparation.
I see.
Everything's timed. Now they may serve a gazillion meals, but it is not very high risk because everything is really mechanized. It's like a factory for fast food. Then you have a long-term care facility that puts out 500 meals, breakfast, lunch, and dinner. It's a high-risk group, and it's lots of preparation steps. We only make everything from scratch. So in the morning, they're making French toast with raw eggs. They're making hash brown potatoes by slicing them. They're making, so lots of preparation. That's going to definitely be a high risk thing because of all the temperature control and everything. And then Dustin's running a coffee shop, and all he's doing is brewing tea and brewing coffee, and has milk, but it's going straight from the refrigerator and into the coffee and out the door, and then some croissants and beignets and stuff. And so that would be a look. Does that make sense?
Yes.
And we actually have there's an official form that we fill out actually every year that we evaluate each of the establishments, and we're looking at it to see, are they still this? And that is what their inspection fee is based on, and it determines how many times we go out there. We're only going to go see him like once.
A year.
Right. We're going to go see her with the long-term care facility a minimum of 3 times.
That's a lot.
Right.
And then
There's
if
a
there's
lot
a
of stuff.
complaint, we would also go back for an
Sure.
extra.
Yeah.
Yeah.
They have their jobs. They have their
Yeah.
work cut out
Yeah,
for them,
they
don't they?
do.
And
Yeah.
that also goes to like the Argosy where they have all those different places. So their coffee place may only get one inspection a year,
Mhm.
but the others may vary.
And so then on that note, we also went to Morton Amphitheater, which has actually 20 food establishments within it, but some of them are just selling drinks. So they also have different levels within that. So I got to go out with Bailey and Kyle and Rachel for a walkthrough right before they opened, and they went out several times and were very accommodating. And I mean, I think they definitely deserve some kudos because they helped them get open in time. Because when we went out there, they did not look like they were going to be ready for their June 1st opening. They had several things still to install, and they were able to get it done. They had like hundreds of people there. We had to wear hard hats because they were still doing construction. But they did a good job, and I think our staff did a really good job of getting it done and being available and being able to go out there multiple times to get them set up, and they were able to open. So I don't know if anyone's gone there yet.
Yeah.
But
I'm proud to work with a group that is very enthusiastic with conducting business in this county not difficult.
I agree with that.
This creates jobs. This encourages people to come in here. We're looking for safety. We're not looking to create issues. We're not looking to flex power. No, I am so proud to work with a group that is making sure it's easy for businesses to meet the safety needs of the citizens of Black County.
Well, I
You know,
know,
we have election coming up, right?
well, I know Bailey and her team were at the, pre-construction meetings and all these pre-development meetings and throughout the entire process. And,
yeah.
and making sure that they had everything that they needed. And, a lot of these things, especially for us, it is really cheap to put a sink in on paper.
And you guys determined they're not serving Kava or Kratom, right?
Yeah, no, there.
I think
was not on
that's
the
too
menu.
soon. But it's really inexpensive to put in a sink on paper. It's really expensive to put in a sink when you're walking in through that final inspection. So the better our communication is from the, paper
From the
part
beginning,
all the way through,
right?
it's going to save everybody time and money and frustration,
Mhm.
because no one wants to be thinking, oh, we've got to have a mop sink right here or a hand sink or whatever. No one told us.
Yeah,
Those are not comfortable conversations to have.
especially.
And those are the times when people are like, the health department's not working with us. They're trying to stop us from being successful. Usually we're not. Usually we weren't brought in or weren't told about something until they're ready for that open sign. And when we have that opportunity to be involved from the beginning, we are pretty transparent and vocal about what's needed.
And there was a change in management too. So I think they've been working with them for almost a year, and then I don't something happened where basically they had to start over and re-explain a lot of things to the new management group that took over, or
Wow.
and so they did have to start over, but they were very accommodating, still within the realm of what we could do for food safety. So we have to make sure it's still safe, but
as you
did a
can
really good
see,
job
just her
accommodating
walking in that kitchen in the vinyl room, every piece of that equipment has to be evaluated. Every single thing has to be approved by our team.
and taking temperatures of all of the fridges and freezers, and there's a lot, and this place is huge. So
And lots of different kitchens and lots of,
yeah.
So it's a little overwhelming just looking at it all, let alone approving it all.
Should be a good venue. My report.
Okay. So a little personal brag here. I did get elected to the Missouri Public Health Association section for public health nursing. So I'm just a member at large right now. one of my big projects I'm doing for them is working on our bylaws and getting them updated. Especially like formatting them, because since we are a subsection of the Missouri Public Health Association, they have their own bylaws there, and our formats were widely different. So I'm trying to make sure that is consistent since we are a subsection within that group. Also got us re-enrolled in our STI and TB 340B programs. So those help with the medications that we provide for all those different treatments for those clientele and get them at a cheaper discount. The STI ones, we don't actually purchase any of those medications ourselves, just FYI, that comes directly from the state. But since they give us the medication to hold and to treat patients with, we have to be enrolled in that program. We did start our first fax series at the Mid-Continent Public Library. We have another one next week. We'll be discussing shingles and offering numerous adult vaccines available there. Some exciting news today is that we actually got our yellow fever stamp, just came in the mail. So we're finalizing our certification with Sanofi produces the vaccine. And then after that, they'll allow us to start ordering it and we'll be able to start providing it in offices. So be on the lookout for that coming pretty soon. So we're pretty excited for that. WIC has a few new things coming up. So one of the big changes they're having with their formula starting in July is traditionally for like specialty formulas that some infants do require, they'd go through the WIC program and they would like work with the doctor, get a prescription that way, and then go back to WIC and then work on getting it for the clients. Now it's switching over to providers. Those go to them directly and they'll write the prescription, as a lot of insurances and Medicaid are going to start covering it instead. WIC will still cover if like people who are uninsured or underinsured to make sure that everyone's going to have access to that still, but that'll take off a little bit of the place for some of the WIC staff. Swope did have a little bit.
So Dustin, can I jump in real quick for a question for you? So if you're doing Medicaid and insurance that's covering the specialty formulas, then our clients have to go to what, like Walmart to buy them, or where do they actually go to get the specialty formulas?
I'll look more into that. I think it gets shipped to them directly, if I'm not mistaken, but I'll double check on that.
Okay.
I bet it does.
But if that's, I don't remember, but I'll make a note of it and I'll get back to you. So did have a little bit on their patient satisfaction surveys. I only had 3 respondents this year, or for this month. One of the comments they have is that they really like how fast and friendly and knowledgeable the staff is. I did note that like their numbers were down quite a bit compared to last year. I knew I'd get asked about that, so I went and called Gina, their clinic manager, and asked like, hey, kind of noticed this, what was going on? Zara, their nurse practitioner, who's their primary provider, actually went on vacation a lot during that month, so that kind of impacted a little bit of it. They did have like a temporary provider to kind of help offset that, but some people, like, you know, you have your medical home, you like your own provider, they opted to wait. I think initially they had, I think 90 appointments originally were scheduled and several canceled or rescheduled because they were wanting to wait for her to return. So take that number with a grain of salt. I did put it on their report too. That way you guys were aware of that. So,
but it does say, can I interrupt again? So then, yeah. Their plan isn't to have someone come and cover while that person's on vacation. They just essentially shut down those appointment visits because there's no provider. Is that kind of what they're doing?
No, they had someone who was here to cover for that. Just how most of the patients opted to like cancel or reschedule their appointments. So whenever Zara returned, so they could see their regular provider.
Okay, so then they just rescheduled for the next month, or they went to Riverside instead?
I'm assuming rescheduling for the next month because Zara works at both of those clinics. So I don't have access to, I'm not sure which ones they went to, but I imagine they were waiting until she got back for likely this month.
So I imagine they were told she was not there and not available and on vacation. Mm-hmm. And they said, hey, can I just reschedule for when she gets back? Mm-hmm. And it was wherever she was at, either there or here. And they don't care where they they don't try to make it one location or the other. And I know in Riverside, they had some building issues, mm-hmm. and they actually 2 weeks ago, they were here on Friday just so they could, or was that last week? Was it last week?
Maybe.
well, 2 weeks
I think it
ago.
was 2 weeks ago, because I think I was,
Time
yeah, I
flies
was
when
on
you're
vacation
having
when it
fun.
happened, of course.
So, but they worked out with us so they could work out of here that day.
So
So
the difference for 1 month with their primary provider out and with a substitute provider in, we only had 19 patient visits difference from 1 month to the next. I am not sensing that there's a deep issue here that our citizens aren't getting taken care of.
but it is,
Thanks.
we're what, Dustin in particular is sensitive to these numbers because we're trying to do what we can to get the numbers up. So that's why he's
Okay.
reporting that way.
And again, like, because I noticed a trend that they've been increasing their numbers from compared to last year. So when I saw that, I'm like, there's something going on. Let me reach out to Gina and see what that was.
And I do appreciate Dustin like making these footnotes. He's trying to anticipate like your all's questions, but this is exactly what I'm asking him. Like, what's up with this? Why the decrease, Dustin?
As long as it's not dissatisfaction, lack of adequate care, if our citizens are getting well cared for from the people we're allowed to contract in here, we're doing our due diligence to make sure that that's taken care of.
But I do appreciate the context.
Yeah, very good, very good.
But yeah, that's basically my report. See if there's any other questions.
Dustin, I appreciated that in your report. I did notice it and it made clarification and it decreases, it improves our meeting efficiency. Thank you. Thank you very much. All right, so the new lady gets to go next, right? Oh, wait, what's her name? Oh, sorry, Cheyenne, would you like to go? Gotta harass her just a little bit.
Yeah. During May, Rebecca and I worked a lot together, which I very much appreciate, that she showed me all the documentation, where everything lives, what to look for. We worked a lot on preparing for the site visit. We have not heard yet when the site visit will be or the range of days that it will be, but since I was able to meet with her so much, I feel good about being adequately prepared for our site visit. So I'm very grateful that I had that time with her before she moved on. While she was here, Rebecca did create a new quality improvement worksheet for our QI committee. And I think that will make the process a lot more efficient and the formatting will be all consistent, which is good. We did have another World Cup presentation to all of our staff. It's the same presentation that occurred in April. We just had a second one in May for any of those staff members that couldn't make it to the April one. Continued to support other health departments. Randolph County, they are a little bit ahead of us in their accreditation process. So we've been talking a lot with them. And then for emergency management and our epidemiology and communicable diseases, they're working with partners to prepare for the World Cup. And knock on wood, everything so far so good in terms of World Cup. So
I would like to request to be notified when they're gonna do their site visit. I'm curious to come and just quietly squeak along like a mouse and just observe.
Will we be
I'm
able
sorry you guys don't get
We'll
really
get
the
to you.
option.
Okay,
You have to be told.
Yeah.
thank you. I wasn't demanding. Just,
No, it's actually part of the process. So
oh,
you will
good.
get invited.
That's a
And
bonus.
we are actually.
I wanna be there. I can't speak for them.
We obviously can't volunteer you to do anything, but we are going to need.
You're
some-
letting us know it would be in the best interest of the health department in Platte County for the
We will
board to be
need some
there.
people to come. Need some
No,
board
How
much
members.
many, do they want all 5 or do they just want 2 or 3?
I think everybody who can be there should be there, but
So we will let you know.
Can 5 of us be there?
So you.
without
all can-
posting a meeting. So if
So-
there's more, 3 or more of us there, then you'll just post it.
We will post it.
Okay.
You always we can always have a meeting. We just have to post it.
Yeah,
Okay.
just post it.
And when we find out when the stuff is, we will invite you. But yes,
How
they
much
will
notice
want
will you
board.
receive?
What's that?
How much notice will you receive?
We will have quite a bit of notice.
Okay.
And there will be portions of the visit that they'll want to talk to staff, but there will be portions that they will want the board feedback and participation. And so we will definitely make sure, and we'll probably just go ahead and post
We'll
those.
tell them this is the
And
first we're
just-
hearing about some accreditation deal.
Okay, we will not be posting it.
Right.
We're going to be like, what board?
Exactly, right? Right.
And actually, we will just invite everybody except Dr. Shopping.
Smart.
We'll ask them, what is a measure?
Great.
That's a good question.
What does?
You've never heard of accreditation, don't know what measures are.
Well,
Great.
I already made,
How's that sound? Does that
I
sound
made
good?
his former
I
colleague.
think you're getting on his list.
Yeah. I made his former colleague uncomfortable at the last NALBO meeting by asking her if they have gotten data that demonstrates that being accredited improves health outcomes. And I saw this young lady, very bright, very good, answered my question very well. Quickly looked over to Andrew, and I think the poor guy went, "He's not with me." But I was curious,
He was just sitting next to me and
Yeah.
leave me alone.
right? Yeah, I was a puppy dog chasing around. No, this is good. I would very much, so, okay, this is a good win-win.
we should have at least a month notice, but probably 2 or 3 months. And
We'll have as much notice as we have, and I can't speak for the board, but I thank you for letting us know that they want to interact with the board. That's good.
It's actually one of the critical pieces of the accreditation. So yes, they will want.
We hope we don't sink you guys.
I will add one quick little fun fact for the World Cup. I was on a call earlier today, and from emergency preparedness and some of like the sewage water surveillance they're doing, they're actually checking like opioid substances as well. So they've seen a little bit take a synthetic ones as travelers come in and like want to party more. So those are things that we're looking at too as they're. I know they're at least doing for the Kansas City wastewater surveillance, but just a fun fact for today.
All right. Financial report? Oh,
Yeah,
wait, we'll go to, wait, we did the accreditation.
it's me.
Art, Shane, where you come?
Yes.
Subcommittee chairs, finance?
Yes, we met last Tuesday on the 9th. And our main topic of discussion was credit cards and how they would be handed out and limits and that type of thing. So as of the end of that meeting, which I think maybe still stands, and if it doesn't, you can correct. I think we were looking at 18 credit cards. And Dawn,
We added 2.
18, yeah.
yeah, so Dawn would have the largest, which would be around 15,000.
So one thing we found out actually
yes.
about the cards,
Okay.
is that they gave us a limit for all of the cards combined. So we are now working with them to increase the limit. So
Oh,
those
okay.
numbers were not per card. That was the total amount, which we found that out after the
Oh,
finance committee.
okay.
meeting.
We're
We don't
kind of
know.
on hold
Okay.
at the moment. on
So we're
the
still
card
discussing, okay. But I think we're still 18 cards is what we kind of looked at. We added a couple in there. And then,
And just so you all know, it's basically going back to making sure everyone who would make purchases has a card, so we aren't having people use other people's cards. It's all about
Accountability.
accountability. And then these cards allow for us to get award or rewards, I guess. Not awards, like,
Yeah.
oh, good job, Andrew. But rewards, so it's basically like 1% cash back reward. So instead of a debit card where we get 0, we are going to get money back for our purchases. So,
That we pay off every month.
right,
yes,
so it's just
And-
another way to get a little bit of money.
I think it goes without saying that there are processes in place to review all the credit card expenditures. So, and that, I think goes without saying.
Right.
yes.
So that doesn't change. It's just the method of payment. And it's kind of like what we had talked about last month on the electronic fund transfer. There was, a question, do we need to approve that process? Well, the board didn't really need to approve that process. What they need to approve is the expenditure. Cause it's really not, when we are approving those things, it's like, are we signing a check? You know,
Mhm.
it's just that.
Agreed, but I do believe that it would, I would like to think it's in the board's interest to make sure that the processes are in place to protect the taxpayer dollars, which there are, and we've done that, so.
So anyway, so we'll be ongoing with that discussion. And then we also just started reviewing the human resources policy on evaluation, annual evaluation increases. So we're in the process of working on that as well.
All right, thank you, Susan.
Mhm.
I don't think we have any other committee reports. Financial report? Does anybody have any questions on financial report as provided in advance? All right, shall we then move on to approve the bills?
I'll make a motion to approve the bills from May 22nd to June 18th, 2026.
Second,
I'll second.
moved and seconded, without, if there's no objection to moving straight to a vote, we shall do so. Roll call vote, Susan,
Yes.
Kim,
Yes.
Michael, yes, Kingsley,
Yes.
okay. We need to now move on to fee resolution amendment.
There's 3 new labs that we're adding
Okay.
for titers. Hep B, varicella, MMR. So they're brand new.
Okay.
The Hep B will be $8 fee. The varicella is $38 and MMR is $49.
Okay.
Dustin, you want to talk about why we are doing
Yeah,
that?
sorry, I should have had this in my report. Please spec out on that. So we've been talking about different ways to like increase the number of income and revenue, and we always do like point of your own goals, TB blood tests and TB skin tests for a lot of clients, especially those. This time of year, we see a lot coming in, like for like, you know, getting ready for med school, things like that. So like, you know what, why not try to be a one-stop shop, expand our services a little bit and offer the blood titers, because that's usually a pretty big request. They're gonna go somewhere to get it. We're already in there drawing some blood anyways, so why not try to make it a little bit easier on these students? So
You said the quantiferin gold is how much?
I think you should guess.
60-ish,
that's exciting.
It's
65.
$30 at most urgent care centers for a TB time test, which requires them to come back in the time window, as you guys are aware. So I think that there are some clients who may find that to be a more cost-effective test. I'm just curious at the number, so.
That's pretty common with a lot of like the med students. Like they'll get pretty short notice, like, oh hey, you have like a week and a half or 2 weeks to get either a 2-step TB test or get a blood test and be done with it. So they're like, I'm busy, I'm getting that blood test. And
I've done 2 this week out of the urgent care.
Yeah.
And they all elected to do the blood draw so they didn't have to come back, which
Yep.
was fine. Then could you scroll down to the motion to that we have for the price change?
Yeah, motion
Yes.
approved.
I entertain a motion to approve the new lab services as mentioned by Cindy.
I'll second that.
Any further discussion? Hearing none, we'll do a roll call vote. Susan,
Yes.
Kim,
Yes.
Michael, yes. Jeff,
Yes.
motion passes. The next one, Public Health Emergency Preparedness Amendment 2. It appears that reauthorizations for a grant, essentially. So if you could scroll down just a tiny bit. I would entertain a motion to move to authorize the director to sign the PHEP contract with Missouri DHSS for the period of July 1st, 2026.
So I love your initiative, but one thing I did want to add is we didn't include in here, we also, in this last couple days, got the CRI, the City's Readiness Initiative, which is also an emergency response grant. So if you just want to say the PEP and CRI grants for approval. The city's readiness initiative is another emergency response grant, and we just got that contract in a couple days ago, so I don't think it was in your original report.
Okay.
but
Um,
that is also,
is that something that is needed to be handled today? And if so, we can do so. We've got this in front of us. Do we need to modify our language to
yes.
apply to
you
both?
I think if you just say, the FEP NCRI grants,
The
the
what?
FEP NCRI contracts.
FEP?
PHEP
Oh, PHEP. Oh,
and
and,
CRI.
contract.
If you
and
just
CRI
add
contracts.
that in here. Usually they come together.
Cindy sent it to you.
Oh, that was the addendum.
It was the separate
Yeah.
email.
Oh, yes, I did see that. Okay, and I didn't know is it appropriate for us to handle them both in
We
this?
normally do them both
Which is fine.
together. For some reason, they only sent us one, so we had created the
Well, I
memo
think
just
we
for
actually
one.
do them separate.
Oh, well,
So
last year we did them together.
however we want to do them. So
Okay.
you can,
We're flexible. This isn't,
it would be easier, they're listed separate on the amended agenda. But if you want to just say sign the FEP and CRI contract,
we can lump everything in together. So, all right. I would entertain a motion to approve the city's readiness initiative and public health emergency preparedness amendment. Number 2.
Move to authorize the director to sign the PHEP and CRI contract with Missouri DHSS for the period of July 1st, 2026 through June 30th, 2027.
Second. Susan,
Yes.
roll call vote. Susan,
Yes.
Kim,
Yes.
Michael, yes. Jeff,
Yes.
employee appreciation presentation. I have 8
can you give
minutes.
us just a second?
You got 10. I'm trying to get it under now. Oh,
Sorry.
I don't know how you
I
guys
just
put up
I
with
had
me.
to verify the dates to
Oh,
make sure the
okay.
dates were right.
Maybe you didn't trust me on the dates.
No.
No, when we combined it,
He's
I
still
just
doing his
needed to make,
director stuff.
Trust issues.
well, when we combined it, I had to make sure the dates were
We
correct.
got you.
All right, well, I don't know if he's gonna be able to do this in 8 minutes, but we'll see.
So I don't believe in the past we've ever done this. But I think most of you know, we celebrate our employee appreciation for the staff during this May, June kind of time. And for most of the years since I've been here, we've done it during June. And we don't celebrate like Nurses Day or Admin Professionals Day or Chimney Sweep Day or whatever.
We're
We
just all
just kind
together.
of celebrate Employee Appreciation Day. And we do a gift and we do a luncheon and it's nice, but we don't really bring much to the board as far as appreciation. And I know we talk about some of the staff, especially with the customer satisfaction survey, you'll get to hear about some of the staff. And I know on occasion we'll have staff recognition through, whether it be the Christmas party or whatever. But I think from now on, unless the board hates my presentation tonight, you're going to hear annually just a little bit more about the staff. So a little bit of background. I think you all know our mission, vision, and values. Our mission is to promote health and prevent disease in our community. Our vision is health and wellness for all. And our values are customer service, accountability, collaboration, health literacy, evidence-based practices, and transparency. And truly, we could not do those things without our team. We have roughly 35 people. That's full-time, part-time, and PRN. We have 6 divisions. We provide public health services for 113,207 citizens across Platte County. We are Missouri's 10th largest county. We have 6 divisions. That's administration, our public health clinic, our women, infant, and children's supplemental nutrition program, our health education division, environmental public health, emergency response, and epidemiology. So all that sounds just like any other presentation. Here's our team. it only took us a couple years to finally get our group picture, but now we have our matching clothing. We all called each other and say, hey, what are you gonna wear? So our blue t-shirt. So now we will be taking these pictures every year, roughly the same time, so we can compare that. And everyone's actually smiling and happy, and what a good looking group. Yes.
I would make a formal suggestion that if you hadn't thought of it, that those photos, if there's an area in the,
They're
yes,
going
never
on the
mind.
wall.
Thank you. All right. Apologize. I'll shut up.
So over the past year, and so we will be, when I give this presentation or whoever gives this presentation, hopefully we'll be following the time period of June 1st to May 31st of each year. So, but over the past year or over that time frame, our new faces, she hasn't changed her name yet, so it's Cheyenne Brunkow, will soon to be Bandy. But she started as a health educator and now as our accreditation and QI manager. She started in August of 25. Andrew Carpenter, our emergency response planner, November of 25. Emma Rowe, our public health nurse team lead, she started in February of 26. Ethan Roach, who Taylor mentioned, our public health intern, he started in May of 26. We have an employee recognition program for every 5th year of your anniversary, you get recognized with a small cash gift. Lisa Dandridge had been recognized back in December for 25 years of service. She is in WIC. And that picture actually was not when she had started. I can't go backwards. But it was sometime before this year. Paige Hyatt celebrated 20 years. And I asked Paige, I'm like, so was that when you were just a baby? And she's like, no, that was only like 13 years ago. So, but promotions over the past year, we've had a lot. So Cheyenne was a health educator, and now she is our accreditation and quality improvement manager, and look how much happier she is. So, and you're going to see a lot of these going from a 1 to a 2. And we have talked a lot about kind of succession planning and moving up in responsibility, but a lot of our positions as 1s are kind of our entry level positions. So moving to the 2 position may not necessarily seem like a huge step, but it means they successfully completed their orientation and their training, and now they are no longer entry level. They have a higher level of confidence. They are moving on to that next level. So this is how we start them off in their public health careers. And it really is kind of a, big thing. Kyle Bledsoe has gone from an environmental public health specialist 1 to a 2. Taylor Harris, Assistant Director of Accreditation and Quality Improvement, has become our Deputy Director.
She's not smiling as much now as she was then. What are you doing to her?
Yeah, I don't know if she's happier or not.
Oh my gosh. We need
I
to
think
keep
she's
her.
always happy to be around. Aaliyah Henderson, she was a public health disease investigator 1, now public health disease investigator 2. She's happy all the time if you've met her. Paige Hyatt moved from bookkeeper 2 to administrative services supervisor. I think her smile is there. She has a lot more responsibility. I don't know how happy she is. Abby Hunt, health educator 1 to health educator 2. Abby Rose, administrative clerk 1 to administrative clerk 2. Rachel Simpson, environmental public health specialist 1 to environmental public health specialist 2. look at her closely. She's in a lot of these pictures. We did have one retirement. This old guy. Don't tell him I said that.
Oh,
Dan Lubert, who
Mm.
retired
look at
after,
that picture. Did
after
he approve it?
no. But I figure possession's 9/10 of the law, so
Oh,
we have the picture. But after almost 34 years of service.
Yeah.
Awards that the staff have received over the past year. So Rachel Simpson got $1,000 scholarship for the Edna Dell Winnell Scholarship from the Missouri Public Health Association. Lisa Dandridge with our WIC program got a special award from the Missouri Public Health Association for her service in WIC. Taylor Harris, now Taylor picked this picture,
Yeah.
probably to get me in trouble with you all. But got the mentor award. I believe she was nominated by Rebecca.
Patricia.
Or Rebecca and Trisha.
Cool.
I'd forgotten that.
That's goosebump
Andrew-
material.
Andrew
I'm
Chris-
sorry, I'm just an old soul. I'm sitting here going, that's goosebumps when
Yeah,
your
that's neat.
folks just appreciate you. Congratulations.
Thank you.
But I had the privilege of giving out the awards because no one else in MPHA ever wants to do the awards. So they always make me get up there and give them out. Accreditation, this is just a credit to all the staff, but they worked really hard to turn in our accreditation documents, turn them in, but actually work on them. Just hours and hours and hours of effort. We received a Senate resolution over the past year. It was awarded to Abby Hunt, Rebecca Richardson, Trisha Rothweiler, Andrew Warland, and Avery Warland, all named specifically in the resolution, which I know for a lot of those folks, it was really, even for me, it was super cool to be named in that resolution. And for me, it was really cool to be named with my daughter and something. So, which
Yeah.
was Avery, in case you couldn't tell from the names. It was not Trisha. Graduation. Aaliyah Henderson graduated from the University of Missouri with a master's of public health degree. So huge congratulations to her. And some other congratulations, Paige Hyatt and Bailey Moore here striking a pose at the 2025 Fall Emerging Leaders Academy graduation ceremony. I believe Cindy and Taylor and I were all there to celebrate that. And Elin Taylor's mom was there, but Taylor's mom was there playing pickleball because she plays facility.
She's top notch.
So her mom was just there eating the free cookies. So I don't know what that so through Midwest Public Risk is where we get our insurance for the employees, and also through we get our liability insurance and stuff, but they have walking challenges. And I've been very lucky to have Heidi on my team. But in our last two challenges together, Heidi accumulated over 1 million steps, and our team has gotten like.
Does she have a trimmer?
I don't know. But we've gotten like
Oh,
fourth
God bless
and
her.
fifth place.
God bless her. That's awesome.
I've met in each one of those, I missed one day of meeting the goal. So I've walked, I've met the goals for the most part. She is a machine. She is like insane.
Like
Those,
next year,
those
get up and
numbers,
run.
those numbers would make an orthopedic surgeon cringe or be happy. Depends on
Yeah.
your point of view.
Crazy, but
And look at the smile. She's like,
yeah,
she needs ears to be the
Yeah.
Energizer Bunny. That's awesome.
exactly.
$1 million girl there.
I was elected to the executive board for the Missouri Center for Public Health Excellence. Dustin Guest, I don't know if any of you know him. He started his Master's of Public Health program at University of Missouri. He wants to be like Aaliyah someday and graduate. Rachel Simpson started her
Mm.
Master of Public Health degree at Missouri State University. Is that better than any?
I don't go there, so I don't know. I'm gonna say maybe.
Okay. That's very politically correct.
Yeah.
And I think most of you know, whether we live or work here, we're part of the community. And so, you know, we have so many events and do different things, but this goes beyond just our work time. So Nancy and Alana and the pictures here, the True family, they ran the Mother's Day 5K together, which that is a fundraiser for the back to school fair. And then Kirsten Spencer, who's in that third picture, she ran her first 5K, and this is the first Saturday in May.
Yeah, the day before Mother's Day, the 10th,
Right.
I think it was.
We've had 2 blood drives. I'm surprised they were successful based on who coordinated. I'm joking. Cheyenne did a wonderful job coordinating our first 2 blood drives. But one of the things that just amazed me was we had 2 staff that gave blood for the very first time. And Frank, who's on the very left, you know, yes, he's super young, but it was his first time ever
Looks a little
giving blood.
suspicious of others around him.
He is
He's not so
suspicious.
sure. Just saying.
I think he's actually just eyeballing the cookie table.
Oh, okay.
Maybe he didn't know why he was there. I don't know. His wife works here too, so maybe she just tricked him.
That makes sense. When the boss speaks, people listen.
And there's Cheyenne being all happy that she tricked all these people to giving blood. And then Carla Hunt was also a first-time donor. So pretty amazing turnout. The first time we almost doubled our expected goal, and the second time we missed it by our goal by a couple units.
Yeah, a couple units.
But they doubled our goal, so it wasn't really fair. You know, I think so much of, and you all know this with your work, sometimes the line between who your friends are, who you spend time with, and your personal life and your work life, your people are who you work with. And when you get married or you have a child or whatever, you share that with your work people, your work family, as much as you do your other family, because who do you spend your waking hours with? Your work family. And so we celebrate these big life changes together. And we have Alana got married on May 23rd to Zachary Grosh. Cheyenne, I don't know if we know her, but and technically she wouldn't qualify, so she'll get mentioned next year too, because she likes the spotlight.
Our honeymoon, our wedding pictures haven't come back yet, so they will be in next year's.
It's
But
Caribbean,
It is, yeah, I think so, St. Lucia.
St. Lucia.
Yeah.
I went there for my
Caption
60th
to
birthday.
Holy Weds.
I think I recognize where you were. Anyway, never mind.
But Cheyenne and Jake got married on June 6th, so she actually technically missed the deadline by 6 days, but I figured she'd get some honorable mention. You're welcome.
It's a cute picture.
Abby Hunt and her fiance got engaged and bought a house.
Okay.
And Abby was kind of scary with the screwdriver there. Don and Frank welcomed a new granddaughter, I believe their 4th grandchild. Rachel, again, guess that's your person, but Rachel, again, and her husband, Matt, bought their first home. Uh-oh. Can you go back? And I guess
It's different.
I guess
That's
so.
what a cute name for the.
It's because he was so round as a baby, when he tried to eat his food and drink water, his back legs would pop up.
Okay.
It's like-
It's like a little zipper.
but a really fur baby.
He's cuter now. He's actually growing his hair.
And as we had mentioned about the customer service survey, I did want to just kind of highlight some of the things people have bragged about them. But Nurse Jackie is amazing, so kind and good at explaining everything clearly. I saw Nurse Jackie, she was extremely kind, so calm and nurturing. I think this is truly the best care I've ever had in my life. Alana was so nice and helpful, helped me get everything done quickly and efficiently. Very friendly staff. Carla was wonderful. She provided a lot of vaccine education and answered all my questions. Carla was amazing. She was very kind and helpful. Kyle and Rachel were very helpful and accommodating. Kyle and Rachel were patient and friendly and stayed after hours because we asked so many questions.
Where's the donut comment?
Yeah,
Yeah.
Oh, didn't get that twice, but didn't come out.
Didn't make the slide.
I'll get him some coupons to raise donuts. He doesn't have an excuse now.
Lisa in the WIC office is such an incredible person.
Aw.
She's so nice and welcoming. My visits with her are very informative. The front desk attendant at the WIC office, Lydia, is always so welcoming and helpful with everything. Juanita she is absolutely amazing. I love the staff. Juanita and Jackie were great. They made my visit easy and worry-free. And like I said at the beginning, our people make everything we do possible. And, as you can see here, there's lots of smiles. They enjoy what they do and they love serving the citizens. And they're welcoming and friendly. I don't know about this guy's choice of headwear, but that's actually a chauffeur's hat. As he's driving
We
all
actually
these
have a chauffeur that's
people.
I didn't know who that was at first.
I didn't know that was you.
We have a professional chauffeur that drives us around.
Where's the tux?
Take a double one.
I
there.
did not wear
Dressed
my
out.
suit that day. And I have a little app on my phone that displays their name to pick them up. Tia is here with, all these are diapers. CPR class, food trucks, is that what that is? Harvesters. I'm not sure what, was this strategic planning? No, this must be
Probably a Christmas party or
Christmas
something.
party, something.
Yeah, there's a green and
Um,
red on Polio.
Not sure what this is.
That arrived alive.
Yes.
That's
The
the
traffic
garden.
garden.
Yeah, the traffic
Okay.
garden.
This is Jenna and Wick. This is the oldest picture of Michelle ever. I'm not sure.
It's a nice picture.
It is. I think it's her favorite picture and the only one she would let us put on the
Okay.
thing. And this is probably the picture you have up on the wall, right, Cindy? And this must be the back to school fair? And I'm not sure.
That was Halloween.
Okay.
Trunk or treat.
Okay.
Their tooth fairies giving out
I was
toothbrushes.
gonna say, I
Oh.
think they're fairies.
Okay.
There's a line.
And Trisha and I cleaning and making faces. I don't know what we're doing.
And then this is our crazy picture
Yeah,
of
that's fun.
our group picture.
I love,
But I thought you might all
I
appreciate
love that.
the employee appreciation.
Is there any, I think 90% of this would be appropriate as a brag link on our website. I think this, because I'm seeing a lot, what I want to weigh in on for a moment, as being someone who's had to have multiple employees, who has seen businesses have challenges with turnover, to see we don't have, I think, an inappropriate turnover rate here. I'm guessing. We don't have too many turnovers compared to other health departments. We've got internally people getting educated. People are improving their careers, doing fun things. This is I'm very proud to be affiliated with you guys. This is awesome. That's all I got to say.
Thank you.
Good job.
That's awesome.
Hey,
Way
hey,
she-
Andrew, can I ask a quick question about something though? Are there any state meetings or anything that we're supposed to go to, like the one that's usually in Columbia? And is anybody interested in going to Nalbo?
So the September meeting in Columbia will be at the Lake of the Ozarks in September instead of Columbia.
Okay.
And I don't believe they've actually put out the registration stuff yet for that because they just finalized the agenda. And then I haven't heard about Nalbo yet.
Nalbo, I'm looking at the website right now. It's in San Antonio and it's October 12th through October 14th.
So I guess I just need to hear from the board if anyone's interested.
Wouldn't mind going to either one or both, but I don't want to take somebody else's spot. If Zach or somebody wants to go, more power to them.
I see Dr. Chaffee looking at his calendar,
Mhm.
so, you know, and we can pretty much,
No, I'm just watching YouTube. Just kidding. Yes, I'm looking. Apologize.
Kim, could you maybe do a little better job of keeping Dr. Chaffee in line?
Right,
Awesome.
right. She's got sharp
She wants
She
none
has
of
sharp
that
objects. We'll be okay.
Don't look at me.
No, I have a trip planned mid-October. I didn't put it in my calendar yet, so I'm trying to look that up, so. Will you be attending Nalbo?
I will probably only go if someone from the board goes.
And that's kind of what I was leaning towards. I'll just weigh in here, guys. I think Nalbo is a struggling organization that's trying to get on its feet, that had filed for bankruptcy several years ago, that has had a leadership void, that is getting back on track. The benefits I've gotten from going there are spending more time with Dr. Kingsley and Andrew and kind of seeing that we're doing things pretty well here. So if it came down to it, if Andrew was going, I'd suggest we have at least one board member go. I don't believe the citizens of Black County would, in my 2 years of going there, I don't know if it's worth the money. I'm gonna be just blunt there. I'm speaking to the board members. But if Andrew thinks we ought to have a board member there, I would wholeheartedly support him. So, having said that, that's really all I've got to add.
That's fine. How about the state meeting though in September?
I think that would be a great meeting to go to, and we'll bring Cindy, if you'll make sure we bring info for that meeting.
Okay, that was all. I was just curious what people were thinking.
And it's a little too late for this year, but for next year, we'll bring info for NACHO, which is the National Association of City County Health Officers, which is a bigger conference than the NALVO, which you all might find interesting.
Really good call.
It's just usually kind of expensive, and our budget was tight, so we actually didn't send any of our people this year. So, but the in-state one is much more economical to send people to. We don't have to do airfare and that type of thing. In fact, we are sending people to NEHA, which is our National Environmental Health Association conference, because it's in Kansas City. So we are sending all of our environmental health people to it because we don't have to send them with airfare. We can send them on the cheap. But Kim, yes, I am sensitive to your personal info and stuff about the employees, but we wanted to share that with
Sure,
the
yeah.
board.
Yeah, that was nice.
I agree with
Yeah.
that's why I said 90%.
Yeah.
And we'll get a reaction. The staff had no idea that this presentation exists.
Oh,
So on Wednesday, we will be having our staff. So every Wednesday following this Thursday meeting, we have a staff meeting. So we will be presenting this. Hopefully it will be better. I'll present better than I did tonight, but I'll present this to them. And then we will have our staff appreciation lunch and we'll get some feedback from them too. But hopefully they will like kind of the embarrassment / recognition will balance out. Because sometimes they don't like being
called
up
out.
on the screen,
Yeah.
but then at the same time, it's nice being recognized and appreciated. So hopefully that balance is right on.
It
But
was done in a very tasteful manner. Yeah.
in the past, we haven't, I feel like the management team that's here often gets your all's eye and attention, but I don't feel like the staff have always been brought to the spotlight.
Mhm.
And at least once a year, I think that's a good thing to have happen. So if you don't have any opposition, I intend to continue doing that.
It's in your budget. Isn't that in your budget and under your discretion?
Well,
We wholeheartedly support you.
so
At
you
least
all
I-
liked it though,
Yeah.
right?
Oh, that?
Yes.
Yes. Yeah, that was
That-
nice.
That should be done every year.
Yeah.
That is something that successful organizations get to experience, but many times they fail to realize the benefit of saluting everybody. And it makes people feel more part of a larger
Well, I
organization.
made you miss your 7 o'clock deadline.
With helping people feel like they have purpose and they are needed and appreciated. That's the best budget line item I think we could support.
Okay. I just want to make sure that you all like hearing about those things. We like
It made
putting
my day.
we like putting it together. And it was kind of fun to go through. I think Taylor said, well, I didn't even remember we did that. And, she's like, oh, I look really cute in that picture. No.
We did that in our department. I'm in the surgery department, and we did it on a larger scale. And the chief of surgery asked for us to submit about me, and so you submit about me with some pictures and about you could say whatever personally what you want to say. And it was kind of cool to see people in their pictures with their families, and their interests and things outside of their job. So I thought that was a way to connect with people. I didn't know you like to climb mountains, things that you don't see people very often, but gave you something to talk about with them.
So we may evolve a little bit, but I do intend for every June to do something similar to this.
I think it is a great addition to the repertoire of the Platte County Health Department.
Okay, great. Thank you.
Very much enthusiastically support what you shared with us. And if the rest of these bozos don't like.
Wow.
Oh, tease it.
Yes.
Of course not. Any other items any of the board members wish to bring up? Dr. Kingsley, you good? Everybody else is
I
good?
am good.
Hearing none, I'd like to entertain a motion to adjourn the meeting.
When is the next meeting?
July 16th,
At what time?
6 p.m.
Where's it located?
Well, I have to look at the agenda because it's on there. So let me see. Yeah, it's here.
Okay, very cool. All right,
I
I make a
don't
motion
know.
in the meeting.
All right. Roll call vote. Susan?
Yes.
Kim?
Yes.
Michael's yes. Jeff?
Yes.
Well, we
Thank
had
you,
3 of us.
everybody.
Don't care about you. I'm kidding.
Bye.